Now, let's talk about prevention and age. We have established that diastasis shows up most often in women after childbirth, and it is not really the pregnancy itself. It is the weak connective tissue underneath to keep diastasis from forming or getting worse. Women should wear a support band for the first 2 months after giving birth, and then wear supportive firming garments from 2 to 6 months. The moment the womb empties, the space inside the belly suddenly shrinks. But muscles that spent 9 months stretching cannot snap back into place in a single second. They stay stretched. In that window, they need help. Outside support takes some of the load off them and give them time to slowly and gently draw back together. After the age of 40, your body makes new collagen more slowly, and collagen is a protein that gives connective tissue its strength. That means the same gap closes faster in a younger body and needs more patience in an older one. Now, let me finally reveal the best exercise I know for diastasis, and the secret behind why it works when everything else fails. The logic could not be simpler. If you want a flat, pulled-in stomach, then you must pull your stomach in. That is the whole idea. Here is exactly how you do it. Pull your belly in as far as it will go. Pull your belly button back toward your spine and hold it there. Do not let it out, keeping that stomach pulled in tight. You start pulling even harder in short, sharp pulses. Try and suck the belly button in deeper and deeper. You can breathe out in little short breaths between the pulses. But in those pauses, you never let the belly relax. How long do you do it? You go until your body says it cannot do anymore. You go until the muscles start to fail and cramp. Then, very slowly, you release the tension. Even if you do it just once at the intensity one I'm describing, you will feel your stomach tighten and pull in a little right away. The reason this works so effectively is that it targets the transverse abdominis, your deepest core muscle that wraps around your body like an internal corset. When you pulse this muscle, it physically pulls those separated six-pack straps back toward the midline, while simultaneously strengthening the fascia. Those two muscle straps that drifted apart get firmer and tighter as you train them this way. They start pulling back toward the middle, and bit by bit, they close that window. I have seen women who were scheduled for surgery with a gap of 7 or 8 centimeters do this exercise for a single month and find the separation had shrunk so much that surgery was off the table entirely. Do this exercise at least once a day. I tell everyone to do it whether they have diastasis or not, because we all need a strong lower belly and a solid foundation for the whole body. You do not need a special position. You can do it lying down, sitting, standing, and you can even do it while walking. That is what makes it so valuable. It asks for nothing, no mat, no equipment, no privacy. If your diastasis is large and obvious, do it 3 or 4 times a day. Go until the muscles start to cramp. That is when you get the fast results. No matter how many times you have given birth, you can get your stomach into excellent shape. It comes down to the right exercises and the right effort. Please take a moment right now to like this video, subscribe to Human Health Zone, and turn on notifications so you never miss an update. If you personally relate to the frustration of a weak core, bloated stomach, or abdominal separation, please comment below and share this video with someone who needs to hear it. Finally, let us know in the comments which city or country you are watching from today. We love seeing our global community of health-conscious viewers. There is a physical condition that you might be walking around with right now without ever knowing its name, and it could be the hidden reason your stomach is bloated, your back hurts, and your core feels entirely weak. Most people assume this issue only affects women after childbirth, but that is completely false. Men get it, children get it, and women who have never been pregnant get it. If someone told you the only fix is going on a knife, you need to stop and listen closely, because that could be the most expensive mistake you ever make with your own body. Welcome to Human Health Zone. If you want real science-backed health information that respects your intelligence, please take 2 seconds right now to click the subscribe button and give this video a thumbs up. Stick with me until the very end of this video, because I'm going to reveal the one specific exercise that can pull your separated muscles back together. But I must mention that Human Health Zone is a fan channel created purely and only to give credit to Dr. Berg, DC, whose decades of clinical experience and research inspire the health insights we share with you today. Now, keeping that in mind, let's talk about what this condition actually is. The full medical name is Diastasis Recti, and all it means is that your abdominal muscles have separated. Picture the front of your belly. You have two long straps of muscle running down the middle, one on the left and one on the right. People call them the six-pack muscles. Down the center, joining them, runs a band of tough tissue called the Linea Alba, which is Latin for the white line. That white line is not actually muscle. It is connective tissue, the exact same stuff your ligaments and tendons are made of. Its entire job is to hold those two muscle straps tightly together in the middle of your body. Here is the key that most people miss. That white line is wrapped in broad sheets of connective tissue called fascia. Fascia is like a wide, flat covering that surrounds each muscle in the front and in the back. In the middle, all those sheets fuse into one strong seam. That seam is what keeps your belly wall firm and closed. But if that seam is weak, if the tissue is loose and slack instead of tight and springy, then under pressure it starts to spread. The two muscle straps drift apart, and a gap opens right down the middle of your stomach. So what pulls that white line apart in the first place? The single biggest cause is pregnancy. Over 9 months, the womb grows and grows, and it slowly stretches every tissue in the belly, the white line included. If a woman has strong, elastic, and springy connective tissue to begin with, then once the baby is born and the womb shrinks back down, the muscles pull back in and the white line gradually tightens up again and closes the gap on its own. But if that tissue was slack and weak to start with, it stays stretched out. It just does not spring back. The separation can be small or large. It can be 2 centimeters, which is a little under an inch, or it can be 3, 4, 5, or even 8 centimeters, which is more than 3 inches. I want to be perfectly clear on one thing. A small separation above the belly button, roughly 1.5 to 2 centimeters after childbirth, is completely normal. Honestly, it is often just a sign that a woman has given birth at some point. That is nothing to fix. That is simply biology. But I have to warn you about the 2 massive mistakes people make when trying to deal with diastasis. Here is where most people get it completely wrong and accidentally make their gap permanently wider. The first mistake is trying to fix it with the wrong exercises. If you have diastasis, you must never ever do exercises that lift your torso or lift your legs off the ground. When you lie flat on your back and lift your upper body or lift your legs, your belly bulges outward immediately, and the pressure inside your abdomen shoots up. Then, as you keep pulling your rib cage toward your hips, you push your internal organs down even more, and the pressure inside climbs higher still. Every time that happens, the white line gets stretched further, and the gap gets wider. So the classic sit-up, the classic crunch, the exact move everyone thinks builds a flat stomach, is a precise move that makes diastasis worse. With this condition, those exercises are off the table completely. Do not do them. The second mistake is rushing into surgery. When a woman has a noticeable separation of 4, 5, or 8 centimeters, she is usually offered an operation to stitch it shut. Most of the time it is done through a keyhole procedure with small punctures. They go in, so the muscles back together, and sometimes add a surgical mesh to reinforce it. On the outside, it looks fine, and it sounds like everything is handled. But surgeons themselves have a saying, and they mean it: the best operation is the one you never had. In the large majority of cases, diastasis can be closed without surgery. It does not take some heroic effort. Think about it. On one side of the scale, you do a few targeted exercises. You strengthen your connective tissue. You take a couple of supplements, and you fill in a nutrient gap or 2. On the other side, you put yourself through the full weight of surgical risk. You take general anesthesia, which is always a shock to the body and can mess with your memory and your mood afterward. Every operation leaves scar tissue behind, and scar tissue pulls and tightens a body toward for years. You should make every reasonable effort to dodge the knife first. Please remember that this video is for educational and informational purposes only and is not a substitute for professional medical advice. Viewers should always consult a licensed doctor or physical therapist for diagnosis or treatment of any medical condition. When we set out to close diastasis, what we are really doing is strengthening connective tissue. If you have diastasis, then you have weak connective tissue. If you have weak connective tissue, then you probably have a systemic issue where your body builds its tissue too loosely across the board. That usually comes with low vitamin D and shortages of key minerals, which are the raw materials your body needs to make strong tissue. As your tissue gets stronger everywhere, every exercise you do closes the diastasis faster. When your connective tissue is weak, it is basically impossible for that weakness to sit in just one spot on your belly. It shows up everywhere. That is why weak connective tissue travels with a whole crowd of other problems. Varicose veins, those swollen ropey veins in the legs, hemorrhoids, organs that sag downward inside you, stretch marks on the belly, the thighs, or the back. You might even experience a heart valve issue called mitral valve prolapse, where one of the heart valves is too floppy and does not close tightly. Bad nearsightedness, trouble with your teeth, your nails, your hair, and joints that crack and bend too far. All of it traces back to the same loose, weak tissue. When you spot diastasis, you can now see it is really telling you something much bigger about your overall health.